Hello. Our ethical presentation is Termination of Pregnancy for Down Syndrome. I am Angelica Castaneda. My partner Karen Feliciano and I will be discussing this ethical issue. So first we'll be discussing what is the termination of pregnancy for Down syndrome. So let's talk a little bit about Down syndrome. Down syndrome is a condition in which a person has an extra chromosome, also known as trisomy 21. Many people with Down syndrome have common facial features and may have major birth defects. Common health problems are hearing loss, ear infections, eye disease, and heart defects at birth. Although they may have common health problems, there is help and most likely solution to them. Sometimes it may not turn out to be the best outcome, but they are still able to live life and function. These problems can also occur with any other baby and be treated as well. I have inserted an image on the slide that is a visual representation of what someone with Down syndrome may look like. They will have a short stature, flattened nose, and face, upward slanting eyes, a single palmar crease, short fifth finger that curves inward. Their feet are short and stubby and have widely separated first and second toes with increased skin creases. Here's a description of termination options. Option 1 is medical induction of labor. It can be a lengthy process as the medication must be administered 48 hours before, and the induction may take a while as well. There might be a chance that more surgery is required if there's retained tissue. There's a higher rate of complications due to the additional surgery to remove the remained tissue. Option 2 is a surgical abortion, which involves removal of the fetus and placenta through dilated cervix and anesthesia. It typically takes 10 to 15 minutes and is done as an outpatient procedure.
So why is aborting a fetus with Down syndrome considered an ethical dilemma? Well, this begins with abortions themselves. Induced abortions on any fetus have been and continue to be moral issues in both medicine and politics. Many of these professionals have been steered by laws and policies made by those with opposing opinions on abortions. One perspective involves anti-abortion, which mainly comes from the idea that pregnancy and life begins at the fertilization of the egg. Some might say that the fetus could feel pain, which would be unethical for any human life. They could also believe that side effects of cancer, fertility issues, and depression might come alongside abortions. On the opposing side are those that are pro-choice, which are people who would want those who need an abortion to have access to them. This idea is based off the concept that women should have the right to decide what they choose to do with their bodies. They believe that the lack of access to a safe abortion would not stop abortions. It would just lead to more unsafe and illegal methods of abortion, which would be risky for both mother and the fetus if unsuccessful. Why does this ethical dilemma focus on Down syndrome? Well, modern medicine has improved enough to be able to predict the outcome and probability of a fetus being born with Down syndrome. These tests include a sequential integrated screening, amniocentesis, chorionic villus sampling, and an ultrasound. Once given a positive result for the fetus having Down syndrome, the mother has to decide whether this is a warning to prepare for the future or to prevent the future. Those with Down syndrome typically have mild to moderate intellectual impairments and delays in speech and motor skills. This would mean that they might need extra help in self-care and personal life. Some would say that questioning the extra effort it takes to take care of a child would be inappropriate and should not be a reason to end a fetus's life. Let's talk about what some people consider as pros for terminating this type of pregnancy. As stated before, children with Down syndrome often need extra care and attention. Parents who know they might not be able to give that could opt out by terminating the pregnancy, which would decrease the probability of child neglect. Those with Down syndrome often require frequent doctor visits and various medications in order to maintain their health. This might be expensive and harmful to the family and can be avoided by aborting the fetus. Another pro involves the subjective idea that Down syndrome is an imperfection of the family's gene pool. Parents might expect a Down syndrome grandbaby born from their future child with Down syndrome. By preventing this pregnancy, there would not be another line of genetics with Down syndrome in the family.
Some cons are that many may believe that having Down syndrome makes them less human, but those with Down syndrome are able to live functional lives with the average lifespan of 50 to 60 years, so terminating would deprive them of that chance. Termination of Down syndrome can cause psychological damage, so some examples are depression, guilt, regret, or nightmares. Another con is that it may lead to future medical problems for the mother. This may include future preterm deliveries as termination causes weakening of the cervix.
These are the references that we use for this PowerPoint. That is the end of our project. Thank you for joining me and Angelica.